In the field of medicine, the patient is the individual person. Traditionally, medicine has been concerned with treating the individual once he becomes sick or injured. In public health, the patient is the whole population, and the focus is on prevention of illness and injury. The old adage is relevant: an ounce of prevention is worth a pound of cure. According to one study, over the past 100 years, life expectancy in the U.S. has increased 30 years. A person who could expect to live till 45 a century ago can now expect to live to 75. Only 5 of those years in increased longevity stem from medical care and treatment, while 25 stem from public health efforts such as social policies, community actions, and personal decisions. Some examples include improved sanitation, occupational safety, better housing, nutrition, and education. Proper disposal of sewage and providing clean sources of drinking water have been key public health interventions in halting and preventing cholera and other intestinal epidemics. Fire codes, as well as biohazard equipment and clothing, have improved occupational safety. Better housing continues to reduce conditions such as crowding, lead poisoning and house paint, infestation by insects and rodents, poor ventilation, and may improve mental health and acts of violence by cleaning up slum neighborhoods. As for nutrition, in the early 20th century, milk stations and school lunch programs were established in poor neighborhoods to supplement inadequate diets of women and children. Public health interventions that aim at prevention are cheaper and more cost-effective than expensive medical treatments such as surgeries, chemotherapy, and pharmaceuticals for illnesses already underway. Yet the U.S. spends only 3% of its total health budget on public health prevention and 97% on medical technology and treatment. Not surprisingly, the U.S. has the most expensive healthcare system in the world, but according to a 2014 report by the Commonwealth Fund, it ranks last of the 11 wealthiest nations in the world in performance and health outcomes. The best scenario is to prevent a disease, injury, or death from happening at all by reducing the risk factors. For example, death due to drug overdose could be prevented by educating the public and getting heroin off the streets. This is referred to as primary prevention. If someone already suffers from an addiction, a harm reduction strategy could prevent further damage and restore the individual to his optimal level of functioning. In this case, harm reduction could include counseling and rehabilitation in a halfway house. In a dire emergency, a medical technician could administer naloxone to prevent death by overdose. Public health includes primary prevention, harm reduction, and medical care to prevent disability or death.